Hi, my name is Alex and this workshop is brought to you by Ethical Health Solutions, where healthcare solutions are ethically crafted. Hello, this is Alex. Welcome to Part 5 of Exploring Healthcare Ethics, a workshop for healthcare professionals. In this session, we will delve into the topic of patient autonomy and informed consent. We will examine the principle of patient autonomy and its role in healthcare decision-making, provide an overview of the informed consent process and its ethical implications, and discuss case examples illustrating the challenges in upholding patient autonomy. As mentioned earlier, we will be working on case studies during this workshop. Feel free to pause the video or wait for the loading bar to complete. Definition: patient autonomy refers to the right of patients to make informed decisions about their medical treatment, based on their own values, preferences, and goals. This principle emphasizes the importance of respecting individuals' capacity to govern their own lives and make choices that reflect their personal beliefs and desires. In practice, patient autonomy means that healthcare providers must ensure patients are fully informed about their medical conditions, the available treatment options, and the potential risks and benefits of each option. This empowers patients to make decisions that align with their own values and life goals, rather than being coerced or unduly influenced by external parties. Importance: respecting patient autonomy is essential for promoting patient-centered care, preserving dignity, and fostering trust between patients and healthcare providers. Patient-centered care is an approach that prioritizes the individual needs and preferences of patients, leading to more personalized and effective healthcare. By honoring patient autonomy, healthcare providers acknowledge the inherent dignity of each patient, affirming their right to make choices about their own bodies and lives. This respect for autonomy also helps build a trusting relationship between patients and providers, as patients are more likely to feel valued and understood when their wishes are considered and respected. Additionally, fostering autonomy can lead to better health outcomes, as patients who are actively involved in their care decisions are often more committed to following through with their chosen treatment plans. Informed consent is the process by which healthcare providers communicate relevant information to patients about their medical condition, proposed treatment options, risks, benefits, and alternatives. This process ensures that patients have a comprehensive understanding of their health situation and the possible interventions available to them. Informed consent is not merely a one-time event but an ongoing dialogue between the patient and healthcare provider, aimed at facilitating a shared decision-making process. Providing information. Clear communication. Healthcare providers must present information about the patient's diagnosis, the nature and purpose of the proposed treatments, and the likely outcomes in a way that is clear and comprehensible. Medical jargon should be avoided or thoroughly explained to ensure patients can grasp the details. Details of risks and benefits. Patients should be informed of the potential risks and benefits associated with each treatment option, including the possibility of no treatment. This includes discussing common side effects, possible complications, and the expected success rates of the treatments. Alternatives. Providers must discuss all viable alternatives to the proposed treatments, including their respective risks and benefits. This allows patients to weigh their options and choose a course of action that aligns with their personal values and preferences. Ensuring decision-making capacity. Assessing competence. Healthcare providers must assess whether the patient has the cognitive and emotional capacity to make informed decisions. This involves evaluating the patient's ability to understand the information presented, appreciate the consequences of their choices, and reason through the options logically. Supportive measures. For patients with impaired decision-making capacity, additional support may be necessary. This could include involving family members, legal guardians, or using decision aids to help the patient understand the information and make an informed choice. Voluntary agreement. Freedom from coercion. Informed consent must be obtained without any form of coercion, manipulation, or undue influence. Patients should feel free to make their own decisions without pressure from healthcare providers, family members, or others. Documenting consent. The patient's consent should be documented in writing, typically through a signed consent form. However, obtaining written consent should be viewed as part of a larger process that includes thorough discussions and, where appropriate, verbal confirmations of understanding and agreement. By ensuring that these components are fully addressed, the informed consent process helps uphold ethical standards in healthcare, supporting patient autonomy and fostering a collaborative relationship between patients and providers. Ethical implications of informed consent. Respect for autonomy. Informed consent upholds patients' rights to self-determination and autonomy in healthcare decision-making. This ethical principle is rooted in the belief that individuals have the inherent right to make decisions about their own bodies and lives. By providing comprehensive information and obtaining voluntary agreement, healthcare providers empower patients to take control of their healthcare choices. This respect for autonomy acknowledges the patient as a whole person with unique values, preferences, and goals, and ensures that their individual rights are honored in the medical decision-making process. Beneficence and non-maleficence. Informed consent ensures that patients are informed about potential risks and benefits, enabling them to make decisions that promote their well-being and minimize harm. The principle of beneficence involves acting in the best interest of the patient by promoting their health and well-being. Non-maleficence, on the other hand, obliges healthcare providers to avoid causing harm. Through informed consent, patients receive a thorough understanding of the potential outcomes of various treatment options, allowing them to choose interventions that align with their best interests and avoid unnecessary risks. This informed decision-making process is crucial for ensuring that the benefits of a treatment outweigh any potential harms. Justice. Informed consent promotes fairness and transparency in the patient-provider relationship, respecting patients' rights to be fully informed participants in their care. The principle of justice in healthcare ethics emphasizes the fair and equitable treatment of all patients. Informed consent fosters transparency by ensuring that all relevant information is disclosed to the patient, allowing them to make informed choices without deception or withholding of information. This process helps to create an equitable healthcare environment where all patients, regardless of background or circumstance, have the same opportunity to understand their treatment options and participate actively in their care decisions. It also promotes trust in the healthcare system, as patients feel respected and valued when their right to be informed is upheld. By addressing these ethical principles, the informed consent process not only supports individual patient rights but also enhances the overall integrity and ethical standards of healthcare practice. I will allow a few moments for reflection, after which we will engage in a discussion regarding the questions surrounding the scenario. Case example 1. Language barriers. Scenario. A patient with limited English proficiency receives medical information in a language they do not understand, compromising their ability to provide informed consent. Ethical challenge. Ensuring effective communication and informed decision-making in multicultural healthcare settings. Strategies. Providing language interpretation services, utilizing translated materials, or involving culturally competent healthcare providers. The time is up. We can now proceed to the discussions about the case. Scenario. A patient with limited English proficiency, LEP, receives medical information in a language they do not understand, compromising their ability to provide informed consent. This scenario highlights a common challenge in multicultural healthcare settings, where patients may face significant difficulties understanding medical information due to language differences. Ethical challenge. Ensuring effective communication and informed decision-making in multicultural healthcare settings is a major ethical challenge. When patients cannot understand the information provided to them, their ability to make informed decisions about their healthcare is severely compromised. This undermines their autonomy and can lead to decisions that do not align with their values and preferences. Additionally, it can result in increased risks and poorer health outcomes due to misunderstandings or lack of proper consent. Strategies. Providing language interpretation services. Professional interpreters. Utilize trained medical interpreters who can accurately translate medical information between healthcare providers and patients. These interpreters understand medical terminology and are skilled in facilitating clear communication. Video or telephone interpretation. In situations where in-person interpreters are not available, video or telephone interpretation services can be used to bridge the language gap. These services provide access to interpreters who can assist in real time, ensuring that communication is not delayed. Utilizing translated materials. Written documents. Provide translated versions of consent forms, informational brochures, and other relevant documents in the patient's preferred language. This ensures that patients have access to written information that they can review at their own pace. Visual aids. Use visual aids, such as diagrams and infographics, that are translated into the patient's language. Visual aids can help convey complex medical information more clearly and are particularly useful for patients with varying levels of literacy. Involving culturally competent healthcare providers. Cultural competency training. Ensure that healthcare providers receive training in cultural competency to improve their understanding of the cultural and linguistic needs of diverse patient populations. This training helps providers communicate more effectively and sensitively with patients from different cultural backgrounds. Bilingual providers. Whenever possible, involve healthcare providers who are bilingual and can directly communicate with the patient in their preferred language. Bilingual providers can help build trust and rapport, making patients feel more comfortable and understood. By implementing these strategies, healthcare providers can better support patients with limited English proficiency, ensuring that they receive accurate and comprehensible information. This approach helps uphold the ethical principles of respect for autonomy, beneficence, non-maleficence, and justice, ultimately leading to more equitable and effective patient care. Case example 2. Capacity assessment. Scenario. An elderly patient with dementia is deemed incapable of making medical decisions by their family members, who are advocating for aggressive treatment against the patient's previously expressed wishes. Ethical challenge. Balancing respect for patient autonomy with the need to protect vulnerable patients who may lack decision-making capacity. Strategies. Conducting a thorough capacity assessment, involving an ethics consultation, and considering advanced directives or surrogate decision-makers. I will allow a few moments for reflection, after which we will engage in a discussion regarding the questions surrounding the scenario. The time is up. We can now proceed to the discussions about the case. Case example 2. Capacity assessment. Scenario. An elderly patient with dementia is deemed incapable of making medical decisions by their family members, who are advocating for aggressive treatment against the patient's previously expressed wishes. This scenario presents a complex ethical dilemma where the patient's autonomy, previously expressed preferences, and current decision-making capacity are in conflict with the family's desires for the patient's care. Ethical challenge. The primary ethical challenge in this scenario is balancing respect for patient autonomy with the need to protect vulnerable patients who may lack decision-making capacity. It involves determining whether the patient can still participate in decision-making, honoring their previously expressed wishes, and ensuring that the care provided aligns with ethical standards and the patient's best interests. Strategies. Conducting a thorough capacity assessment. Assessment by specialists. Engage healthcare professionals with expertise in capacity assessment, such as neurologists, psychiatrists, or geriatricians, to evaluate the patient's cognitive abilities. This assessment should consider the patient's ability to understand the information relevant to their medical condition, appreciate the consequences of their decisions, reason through the options, and communicate a choice. Multidisciplinary approach. Utilize a multidisciplinary team to gather comprehensive information about the patient's cognitive function, medical condition, and psychosocial context. This team can include doctors, nurses, social workers, and psychologists who collaborate to form a holistic understanding of the patient's capacity. Involving an ethics consultation. Ethics committee. Involve the hospital's ethics committee to provide guidance on complex cases. The committee can help mediate between the healthcare team and family members, ensuring that ethical principles are upheld while considering all perspectives. Mediation. Facilitate discussions between the healthcare team, the patient, if possible, and the family members to understand their concerns and preferences. Mediation can help clarify misunderstandings and identify common ground. Considering advanced directives or surrogate decision makers. Advanced directives. Review any advanced directives the patient may have completed before losing decision-making capacity. These documents, such as living wills or durable powers of attorney for healthcare, provide explicit instructions about the patient's preferences for medical treatment and can guide decision-making. Surrogate decision makers. Identify a legally recognized surrogate decision-maker if the patient lacks an advance directive. The surrogate, often a close family member or legally appointed guardian, should make decisions based on the patient's known wishes and best interests. The healthcare team should provide the surrogate with all necessary information to make informed decisions. Respecting previously expressed wishes. Documented preferences. Ensure that any previously expressed wishes or values of the patient are documented and taken into account. This may include verbal statements made to family members or healthcare providers about their treatment preferences. Patient-centered care. Strive to honor the patient's values and preferences to the greatest extent possible, even if they conflict with the family's wishes for aggressive treatment. The patient's right to self-determination should be a primary consideration. By implementing these strategies, healthcare providers can navigate the ethical complexities of capacity assessment, ensuring that the patient's autonomy and previously expressed wishes are respected while providing appropriate protection and care for a vulnerable individual. This approach aligns with ethical principles of autonomy, beneficence, non-maleficence, and justice, fostering a fair and compassionate healthcare environment. Case example 3. Coercion and pressure. Scenario. A patient feels pressured by their healthcare provider to undergo a particular treatment, despite expressing reservations and preferences for alternative options. Ethical challenge. Recognizing and mitigating instances of coercion or undue influence that may compromise patient autonomy. Strategies. Engaging in shared decision-making, exploring patients' concerns and preferences, and ensuring that patients feel empowered to make decisions free from external pressures. I will allow a few moments for reflection, after which we will engage in a discussion regarding the questions surrounding the scenario. The time is up. We can now proceed to the discussions about the case. Case example 3. Coercion and pressure. Scenario. A patient feels pressured by their healthcare provider to undergo a particular treatment, despite expressing reservations and preferences for alternative options. This situation reveals a significant ethical issue where the provider's influence may overshadow the patient's autonomy, potentially leading to decisions that do not align with the patient's values and desires. Ethical challenge. The ethical challenge here is recognizing and mitigating instances of coercion or undue influence that may compromise patient autonomy. It is essential to ensure that patients can make independent and informed decisions about their care without feeling pressured or coerced by healthcare providers, family members, or other external factors. Strategy. Engaging in shared decision-making. Collaborative approach. Adopt a shared decision-making model where the patient and healthcare provider work together as partners in the decision-making process. This involves openly discussing the patient's condition, treatment options, risks, and benefits, and considering the patient's values and preferences. Patient education. Ensure that patients have a thorough understanding of their medical condition and all available treatment options. Provide clear, unbiased information that allows patients to weigh the pros and cons of each option without feeling directed toward a particular choice. Exploring patients' concerns and preferences. Active listening. Take the time to listen actively to the patient's concerns, fears, and preferences. This helps build trust and demonstrates respect for the patient's perspective. Open dialogue. Encourage patients to ask questions and express their thoughts about the proposed treatments. Discuss their preferences in detail and explore any underlying reasons for their reservations. This dialogue can reveal important factors that might influence the patient's decision-making. Ensuring patients feel empowered to make decisions free from external pressures. Creating a safe environment. Foster a healthcare environment where patients feel safe and respected, free to express their true preferences without fear of judgment or retribution. Assure patients that their choices will be respected and supported, regardless of the provider's personal opinion. Second opinions. Offer patients the option to seek a second opinion. This can provide additional perspectives and help patients feel more confident in their decision-making process. Support systems. Encourage patients to involve family members, friends, or patient advocates in the decision-making process if they desire. These support systems can help patients feel more secure in their choices and provide additional emotional and informational support. By implementing these strategies, healthcare providers can better support patient autonomy and ensure that patients are making informed decisions based on their own values and preferences. This approach helps to mitigate the ethical challenges of coercion and pressure, fostering a healthcare environment that respects and upholds the principles of patient autonomy, beneficence, and justice. That was a lot of cases. You still with me? Strategies for upholding patient autonomy. Shared decision-making. Engaging patients as active participants in the decision-making process, collaborating to identify treatment goals and preferences. Communication skills. Enhancing communication skills to facilitate meaningful discussions, address patients' information needs, and elicit their values and concerns. Respect for diversity. Recognizing and respecting cultural, religious, and personal differences that may influence patients' healthcare preferences and decision-making. To conclude this workshop, patient autonomy and informed consent are fundamental principles in healthcare that uphold patients' rights to make informed decisions about their care. By promoting effective communication, shared decision-making, and respect for diversity, healthcare providers can empower patients to be active participants in their healthcare journey, ultimately enhancing patient satisfaction and outcomes. This is where this part ends. Please proceed to the next part and don't forget to share your thoughts with us. Leave a comment below or send us an email at info@ethical-healthsolutions.com with the subject line, feedback. Thank you. Alright, don't forget to subscribe and hit the bell button to receive notifications for new videos from us. Goodbye.